Welcome to Inside Dermatology with Dr. Harvey. Hear trusted guidance from a board-certified dermatologist and Mohs surgeon on treatments, procedures, and expert tips you can actually use. Please don't forget to like, comment, and subscribe. Let's check out today's episode.
Hey, Dr. Harvey. Today I'm going to be talking to you about vinegar soaks. These are very inexpensive ways to treat wounds post-laser in certain select instances. It's a wonderful way to help with healing, minimize infection, disrupt crusting. So let's dive in and see how we do. Okay, so how we make our vinegar soaks is pretty straightforward. You need just two ingredients, vinegar and preferably distilled water. So what you basically want to do is make a dilution of the vinegar. We need about 2 teaspoons per cup of water, and that's where we'll use this process. So how I make it up is we'll just take the 2 teaspoons very gently, and I just put it right into the cup. And this could be a glass or whatever you have. Just need about a cup or so. And then we estimate using distilled water. You don't want to use tap for this. And I'm just going to gently bring this up. Take the prepared diluted vinegar solution, remove it from the refrigerator, and uncover it. Using a clean gauze or a soft washcloth, gently dip it into the solution and wring out any exit so it's damp but not dripping. Lightly place it over the wound or laser treatment area, and you allow it to sit for about 30 seconds to a minute. Don't shear too aggressively. After removing the compression, apply a thin coat of either your prescribed ointment or plain petrolatum. For surgical wounds, I usually cover it with a Band-Aid if needed. For laser-treated areas, it's not typically required. That's all there's to it. Thanks for watching our video on vinegar soaks and how to apply them. For more educational content, check out our YouTube channel at Dr. David T. Harvey Videos. Thanks.